It's a long process. So it started somewhere in the beginning of this century. There was initiated Estonian Health Project 2015, and under this project we started somewhere in 2001 or 2002 to describe the needs of different user groups. At that time I was chairman of Estonian Society of Family Doctors, and I was asked to be one of the project members to describe the needs for family doctors. 2004, Estonia applied to get to the funding from the European structural funds, and in this papers there was already description of what kind of system we want to launch, what is the outcomes and main targets. So then 2005 that was already known that we will get this funding, and one of the parallel projects in that time was to give different scenarios. How should this kind of digitalization processes be run? Who should be responsible? In the end of 2005, there was discussions, and then Estonian eHealth Foundation was founded by different stakeholders, and the main stakeholder was state, and then two biggest regional hospitals in Estonia, three biggest regional hospitals, and which cover altogether some 60% of all the healthcare delivery. Then ambulance union, which represents ambulance service providers. Then primary care was represented by Society of Family Doctors. And then hospital union, which represented the smaller hospitals in the county hospitals. So altogether, seven founders, and each of the founders could name one representative to the board, and the state had the possibility to name 5. So altogether we had 11-member board, and the board was then the organization who decide what we should do. And then was under this board there was one CEO who was responsible of operational work. So and this there was two big stakeholders who didn't participate in this founding. First was the Chamber of Doctors, and Chamber of Doctors represented all doctors, not depending of speciality, and they are mainly representing trade union functionalities for the doctors. And the other who was asked was Estonian National Health Insurance Company. We have one national health insurance, but they also refused because they said that their task is more to finance, to allocate resources, and they are not interested of being a founder members. And they have specific law, and it was quite complicated to integrate. But however, the Ministry of Social Affairs named one of the representative of the state, the board member of the National Health Insurance. So National Health Insurance anyway was represented in the board. but they were not the founders. But yes, and in that time we didn't have a strong patient organizations in Estonia. So basically, the Ministry of Social Affairs also represented the patient voice. Like so that was the and after we got the funding from the European Union, then we had the international procurement process, and in 2006 we became a company who was the main producer of the health information exchange platform and sub-projects, and so then eHealth Foundation take the lead, and all the decisions were made in the board of the eHealth Foundation. You have to understand that the e-services were the last e-services in Estonia. So the Estonia did not start it with e-services in healthcare, but it was the last services which were provided in the healthcare service. So the leadership point of view is extremely important, but it was not so important in the healthcare because all solutions, what was needed for the secure delivery of the e-services were already there since 2002, like X-Road for secure data exchange, ID card or mobile ID for the strong authentication. Then the basic principles that no one can collect the data which is already collected by someone else. You have to send a request through the X-Road environment. All the supportive legislation, all the supportive functionalities on handling and connecting different databases together to the same environment, these were already there since 2002. So we have now only to build the specifically services for healthcare sector using the national infrastructure and all the background support. So it was a little bit different than if you start from scratch and starting to build the e-health services as a unique services or separated from the other services. So that was, and I think that was the main success factor for Estonia, that we have one united infrastructure which is up and running and tested, so that was the case. It's crucial functionality. I made my PhD about the success factors of national implementation of e-health systems. And I discovered that those countries who had very clear governance structure of decision making in the e-health field moved much faster and in much cheaper scale than those countries where the responsibility was split between different ministries and different institutions. So this gives you have to have very clear leadership. And if it is in one organization and where all decisions are made there, so we had standardization, we had stakeholder engagement, we had public relations, we had also maintenance the IT systems, we had a help desk, everything in one institution, business process delivery, everything in one institution. So the Ministry of Health only had to convince the Parliament to give the money to the budget then changes in the legislation. This was part what we didn't do. This was part of the ministry, but all other tasks were given to the eHealth Foundation, and I think that this was the key factors that we succeeded in very short time and very small budget to achieve such good results. Yeah, first of all, I want to explain that we don't have any eHealth applications. So we have a free market so that every institution can pick up any software what they want. But we have created a central health information exchange platform which works like a repository where all the institutions have to send agreed amount standardized medical documents. And then other partners can ask from the repository the necessary data what they need. So this is the overall the architecture. Now we can all these X-Road and health information exchange environment is working as a service-oriented architecture. So there is no applications. There is a services which are internal services, which is like handling the messages between different institutions. And there is a services which is available also to the patients or available to the third parties, but they are all built, they are all run in the same environment. So the most successful service is e-prescription service. So e-prescription service is a very busy service. It means that there is a like a 60% of Estonian service environment is run by the prescriptions. And each time when I, as a medical doctor, using my software, starting to prescribe medicine to my patient, my software is sending 7 different messages across X-Road to the different registries. For example, drug registry, reimbursement registry, health insurance registry, business registry, population registry, drug interaction database, and some others. So in the few seconds, I receive all the messages back, and their prescription is fulfilled automatically by these answers of my requests. So I have to only sign, then I first have to gradient name of the drug, and then everything is coming back automatically, pulling my prescription. So, after that, when I have sent this forward to the prescription center, it is signed, time-stamped, securely delivered to the prescription center, which is a repository under the health insurance database. Then the patient can go any pharmacy in Estonia, represent themselves, and buy the prescription. So every pharmacist can request the prescriptions from the prescription center to the screen, make the purchase, and send the necessary information back to the purchasing information back to the health insurance and get reimbursed according to the law. So all these data exchange is 100% digital. So and this is most used service, and it's the most it's voted the most valuable service in Estonia and also in Europe in 2000, I think it was 12 or 14. Very good question. There is several things what we did. First is the general attitude to using the digital services. And it's not specific for healthcare. So we started of educating people in the beginning of century of using internet securely, using ID card. And I think that ID card, which is compulsory, no, it's obligatory for Estonia. Passport is compulsory. ID card is what you must have. So you get your ID card free of charge, and there are services already in the beginning, which are very low-hanging fruit, like tax board and electronic banking. So, and you start to create the trust between society and digital services. And this is general. This is something that government has done last 20 years. And people really trust these services because we haven't had any data leaks thanks to the environment that we're using. Basically, Estonia have used blockchain technology since 2002 because all the messages are logged, and all the logs that we calculate the hashes, and the hashes are stored. In Estonia, it's stored in centrally. So this is and this is the general trust what we have for these services. Now the question about the professionals. So we started in this under this Health Project 2015 roundtable discussions between different stakeholder groups, and the main question was access rights. Who can access to my record? Who can see my notes? So before digital era, the doctors were taught to make notes for themselves. It was mandatory to have medical records. So since 2002, it is possible to have in Estonia only digital records. Before that, it was not allowed to have only digital. You had to have also paper version. But since 2002, thanks to the new legislation, which was not healthcare specific, the paper and the digital format was equalized. Now we discussed in this roundtable that many specialties said that only my professions, like a psychiatrist or gynecologist or infectionist, said that only my specialty doctors can see my notes. And basically every specialty wanted to have some separate rules. And then we said that hey guys, this is not possible. We can't build such a rule engine that every small specialty have your different rules. We have to look at who is the main beneficiaries in this kind of digitalization. And then we had in parallel, we had an ethical working group. Medical ethicists were discussing how we should find the balance between personal autonomy and the benefit for society. And they came out a concept of the attending doctor. So it means that as a doctor, you should have equal right. All doctors and even all other medical professionals like nurses, dental doctors, everyone is equal by the rights. So you basically can't see anyone's medical record, but you can do it only where you have curing relations between the patients and the doctor. So we didn't build any rule engines. So you don't have to convince that you have a right. It is by law you have right, but you have to have a curing relation. And it means that we decided in Parliament that everyone has to share their medical records amongst each other using the Health Information Exchange platform, not asking any specific consent from the patient. But it is said that this is taking away the autonomy of the patient. We have to give something back. And what did we do? First, in patient portal, patient can see everything. 100% the same data which is there and which other doctors or medical professionals can see. So there is no difference who can see. Patient can see the same amount of data. The second, patient can decide not to share data if they don't want to share. During last 20 years, only 0.01%, altogether some 400, 500 persons have declared that they don't want to share the data. So it's very small minority who don't trust or don't want to share the data. And the third is transparency. And transparency means that first, you can see everything what is collected about you. The second is that you can monitor the logs who have looked your data. And these services are available for every citizen to the patient portal. So now you have balance between the society, the benefit for society, and the benefit for the person. So, and this is the access rights are the crucial success factors in parallel with the existing infrastructure and legislation and standardization and other important things. But the access rights is crucial how you build the access rights between professionals, among professionals, and what are the rights of the patient. I think that I touch most of the important factors, and these are access rights. So we use the opt-out approach. It means that we don't need a specific consent for data sharing. Many countries who have failed using opt-in approach. It means that before sharing the data, you have to take a specific consent from the patient. It means that first it takes a much longer time to get all the patient convinced to sharing, and it's more difficult to handle this kind of consent management because you have to know always who have consented, who does not. So this is extra burden, and this is not for the benefit of the helping doctors and patients to communicate. It's additional work. So this is one. The second is reusing national infrastructure and not building a separate ID card for medical professionals, not building separate data exchange for medical only. So this is very important that it is the same infrastructure, the same basic rules in every sector. And third thing is digital education. Education, Estonia has had huge educational programs for different user groups and different age groups, starting from the kindergarten up to the elderly people. Hundreds of thousands of people have come to this kind of digitalization courses to learn how to use securely internet, how to use ID card and other things. Also, we educated all medical professionals what is the change when you go from paper to the digital. And we teach them only one thing that they have to learn. Do not look if you don't have curing relation, because we catch you. So in paper, no one knows who have looked your medical files. But in digital environment, when we're using strong authentication, there will be all traceable trail, and we can find misusers very easily. And these basic link that education, infrastructure, and access rights are the most important thing. And I think that Estonia have had a very fruitful combination of all of these principles. So we have really succeeded to build a system which is user-friendly, in low cost, high speed, and high security.